So we have a guest. Her name is Samantha Olds-Frey. She is the CEO of the Illinois Association of Medicaid Health Plans. And Samantha has nearly a decade of experience in healthcare. She is responsible for coordinating legislative strategies, testifying before legislative committees, and working closely with state agency administrators to formulate and implement policy that positively impacts their members. Prior to joining the association, Samantha was a research and appropriation analyst for the Illinois House of Representatives, where she helped negotiate and craft the Medicaid Reform Act of 2010, the $2.7 billion Medicaid reform package known as the SMART Act of 2012. My goodness, Samantha, you know it all, don't you?
Well, I don't know if I'd say that, Harry, but I've been around the healthcare space and Illinois Medicaid for quite a while, and it's definitely a dynamic program.
Okay, so let's start with this, because, the big reality is that there were many people that lost their health care, when the pandemic set in. And people need to know if they are, if they're eligible for Medicaid. Tell us what Medicaid looks like today in Illinois.
Yeah, so Medicaid is a comprehensive health care benefit program, so it covers everything from pharmaceuticals to hospital care to your traditional doctor services, transportation, medical supplies, etc. So it is a behavioral health, both mental health and substance use disorder treatment. So it is a comprehensive health care package. It is supplied at no cost to members, very low co-pays, if any, and today in Illinois, over 3 million people are enrolled on Medicaid, about a quarter of our state's population. We cover about a third of the children in Illinois, and this always amazes me, but 50% of the births in Illinois, so 1 out of every 2 babies born, is supported by the Medicaid program. So this is an expansive program. And really the healthcare safety net, much like you've said, so many people have needed it in this pandemic because they've lost their jobs, no fault of their own. There are large layoffs. And we're lucky in Illinois that we have the Medicaid program there to serve as that healthcare safety net.
All right, then. So what are the parameters of Medicaid? Do you have to have a certain income level? Who would qualify for Medicaid?
Yes, so there are income levels. So for adults, we cover up to what is called 138% of the federal poverty level. And that is for a family. So if you were just an individual, if you're making less than $17,774 a year, that would mean you're eligible. If you are a family of 4, that would be making less than $30,305 a year. But if you're children, and so this is key, for children, we cover up to 300% of the federal poverty level. So for a family of 4, if you're making less than $79,500, your children would be eligible for Medicaid. And so that way, maybe like you were talking about before, and the ACA and Obamacare, you may be able to get Medicaid coverage for your children and then only have to pay out of pocket for your own health coverage. So that might be more affordable for your family.
What is the difference between Medicaid and Medicare?
Such a good question. We get so many, there's so much confusion around this. So Medicaid is a income-based program, and it covers everybody from newborns to seniors. It does not matter how old you are. It's simply that you fall into an income-based eligibility. Medicare is for seniors and folks who are disabled receiving SSI.
Okay.
So that is a more limited program.
All right. So, what are some of the myths about Medicaid? I have very little knowledge about Medicaid. Unfortunately, I haven't had to use it. I don't even know how it works. But from the very beginning since you've come on, I get the impression that this takes care of all your medical needs, as if, and probably even better than somebody like me or someone that has Blue Cross Blue Shield or some of the other United Care, whatever. All your needs are taken care of. I mean, you get to see doctors, you get to, pharmacies, you get specialized care if you need it. I mean, if God forbid, if you're diagnosed with some horrible disease or whatever, you're covered. And even your mental health is covered, behavioral health, right?
That's exactly right. And Terry, I love the way you described that, but I'm going to even say in Illinois, Medicaid is actually coordinated by health plans. And so you can select, Blue Cross Blue Shield, for example, participates in the Medicaid program. You can enroll in Blue Cross, or you can enroll in Aetna, Meridian, Molina, or County Care. So you're going to have an insurance.
Wow.
And that's really different than, what it was 10 years ago, where, before, it really did feel like Medicaid was a limited health care package.
Right.
Lots of doctors didn't take it. You kind of ended up mainly at the emergency room.
Right.
But now there's been a lot of reforms, a lot of investment in the Medicaid program. These health plans have entered the space, and you can go to your doctors. You can get on and HFS's website, enrollhfs.illinois.gov. You can compare the plans just like you're shopping for regular insurance. You can see what hospitals are in network, what doctors are in network, what specialists are in network, and it's all covered. Pharmaceuticals are covered. You can go, in-network pharmacy, we even cover mail order. So if you're a senior and you don't want to have to go, down to the Walgreens or the CVS or whatnot, you can have your medications delivered to you at no cost to you. Your behavioral health care. I mean, I don't know about you, Perry, but the past 15 months have really stressed me out.
Oh, absolutely.
And so again, if you need to talk to a counselor, if you need medication for behavioral health, all of that is covered, often at no copay. And again, it's being coordinated by these health plans. Again, Aetna, Blue Cross, County Care, Humana, Meridian, and Molina. And so you really are, it is just comprehensive insurance that is going to meet your needs, much like what you had, when through your employer or whatnot. It is meant to be the same, but with lower copays, no out-of-pocket costs, really.
You know what? This is one time that I can honestly say Illinois did something right, because there are a lot of states around this country that don't have this kind of comprehensive Medicaid. Am I correct?
You are absolutely right. We were one of the first states to expand ACA coverage to cover more people. We have a comprehensive health care benefit. We just added with the championing of the Black Caucus and the Black Caucus health care pillar. We're adding health care benefits like doula coverage for moms, for pregnant women. So our Medicaid program, in my mind, as somebody, who's worked in the space for quite a while, it's something to be proud of.
Oh,
it really
wow.
is. Illinois has its challenges, but Medicaid is, we have a strong Medicaid program.
That is awesome. I've been talking to Samantha Olds-Frey. She is the CEO of the Illinois Association of Medicaid Health Plans. And as I said before, I think Illinois finally got something right. We have our issues, but in terms of Medicaid, they got it right. Let's go to Latrice. Latrice, thank you for your patience. Go right ahead. What's your question or comment?
Well, hi. I'm actually calling on behalf of my mom.
Okay.
So my mom has Medicaid, and her issue that she's having is the service is great. She loves her doctors, but the problem is the drug is getting her medication. It's really expensive. What can she do in regard to that?
Yeah, Latrice, thank you. It's such a good question. So for Medicaid, her drug benefits should be covered comprehensively, and her copay should be no more than $2 or $4 at the high end. If she's on Medicare and Medicaid, that might be what's going on, where there's not a coordination of benefits there, and so she's falling into the Medicare piece, but Medicaid should be covering that as well. And so for that, if she has a health plan, I'd have her contact that health plan to ensure that that's being covered with the Medicaid benefit, so it's not just falling to Medicare, where the costs for drugs are higher out of pocket.
Okay, absolutely. Thank you so much.
Oh, thank you, Latrice. Let's go to Claudette. Claudette, you're on with Samantha Olds-Fry.
Yes, hi, Perry. Hi, Samantha. I wanted to know, now, under Medicaid, if hospitalized, is there a maximum number of days that I would be covered under the doctor's care?
Such a good question, and there's not. It's really based off of your needs of care, and again, there's no balance billing in Medicaid. So Medicaid, your health plan, is going to cover that full stay, and they're going to work that out with the hospital, and you as a patient are not responsible for any cost associated with your stay. And I just want to say that's not just for hospitalization. That's going to be for doctor's visits. And so if you are on Medicaid and you ever receive a claim or a bill from your provider, go ahead and reach out to your Medicaid health plan, and your Medicaid health plan is going to contact that provider, because you should not be receiving a bill if you're a Medicaid member.
Okay, thank you.
Thank you, Claudette. Great question.
Claudette.
Let's go to Ronaldo. Hi, Ronaldo.
Yeah, hi, good afternoon, whatever it is. I don't know. I took that COVID shot yesterday, and I don't know what they gave me, but I woke up this morning wanting pizza.
Okay.
And so I have Aetna, whoever. My question is, can I have the Medicaid as a supplement? I mean, I get all the benefits, and I listen to people say they have to pay for this and they have to pay for that and they have to pay for this, and I have to pay $3, and I'm complaining. And that's ridiculous. I mean, this Medicaid thing seems like it's absolutely wonderful. And the reason I'm asking that quickly is because I turned 65. Can I have it as a supplement?
Oh, to your Medicare.
No, I have Aetna, whatever.
No, I'm saying, so you want to know if you can use that Medicaid as a supplement to your Medicare. Right.
I mean, I was able to get the COVID. I'm fine.
Okay.
But I want to know just in case.
All right. Good question. Go right ahead, Samantha.
Perfect. Such a good question. Yes. So Medicaid is often a supplemental to your Medicare coverage, and that is going to be, for example, for Latrice, her mom, is Medicare and Medicaid. So if you fall into the income eligibility for Medicaid, you can have both Medicare and Medicaid to lower your copays, lower your out-of-pocket costs. It's a real important benefit that can help you as a senior.
Okay, Ronaldo.
Yeah, that's it. Thank you.
So, what do you want, Lou Malnati's, or do you want?
I want Benny's.
Okay. All right. Thank you. We've been talking to Samantha Olds-Fry. She is the CEO of the Illinois Association of Medicaid Health Plans. And Samantha, you've been so generous with your time. Thank you so much. And you've been able to answer all of our callers' questions and well. So let's go back to the calls. Let's go to Michael. Michael, thank you for your call.
Hi.
Hi. Yes.
Yeah. I have two questions. One, her association, are they health care providers?
We are health plans. So the association is the care coordination organization. So Aetna, Blue Cross, County Care, Humana, Meridian, and Molina are the members of my association.
Okay. Am I limited to certain hospitals?
With Medicaid.
With Medicaid.
Such a good question. So the health plans have built their networks, much like how commercial insurance does. you can go on the enrollhfs.illinois.gov and look at the networks and look at the hospitals that are in the various networks plans. Now, in an emergency, the health plans will cover out of network. So if you have an emergency and you're right next to, one hospital, it doesn't matter if it's a network or not, they will pay that hospital. But for planned procedures, there are networks, very expansive networks, Northwestern and Rush and Advocate, Loyola. Lots of those hospitals are a network, and you can pick a health plan based off the hospitals and the doctors that you want to see, and you can look at that at the enrollhfs.illinois.gov website.
Say that website again, Samantha.
Yes, so it is enrollhfs.illinois.gov.
All right. Thank you so much.
Perry, you always have the most informative guests. God bless you.
Thank you, Michael. I appreciate that. Let's go to Emmanuel. Emmanuel, thank you for your call. Go right ahead.
Hey, Perry, how you doing?
Oh, I'm good. How you doing?
Great. Your guest is awesome.
Yeah, thank you.
Yeah, I want to know about us veterans. Can we be receiving veterans health care like at Jesse Brown, VA, or Hines, Chicago, and then also be a member of the
Medicaid,
Illinois Medicaid? The reason I ask is because we do pay way too much for prescription medication, and there is no dental for us unless, of course, you're a 20-year retired veteran or inpatient. So I'll hang up and listen, and it's just an awesome show, Perry.
Thank you. I appreciate it. That's a good question, huh, Samantha?
It's so good, and your listeners, I must say, are asking just the most amazing questions. So you can, as a veteran, if you qualify for income, based off of income, receive Medicaid coverage. The Medicaid coverage won't work at the veterans hospitals, but your VA coverage will work at the veterans hospitals. But the Medicaid coverage will work at, just your traditional hospitals. We do have dental coverage as well. And the health plans have preventative and restorative dental coverage. And so they can coordinate that as well.
Oh, wow.
Which is an important piece.
All right, then. Let's go to Louise. Louise, thank you for your call.
Hello?
Yes, Louise, you're on with Samantha.
Can you tell me, is Medicaid the same as Obamacare?
Such a good question, Louise. So it often gets mixed up with Obamacare because Obamacare expanded Medicaid coverage. And so there's a portion of Medicaid that you are able to enroll in because of Obamacare. But it is not the same as the health exchange coverage where you're buying insurance and you're paying a premium and you have copays and deductibles. So it is not the same in that regard, but Obamacare did expand coverage to Medicaid and played a really important role in strengthening Medicaid here in Illinois and across the country and really did a great job at strengthening the healthcare infrastructure.
Okay. And what about managed care?
So managed care is really just a component of Medicaid. And so that is a common phrase that is used. And those are the health plans like Aetna and Blue Cross and County Care that are going to do care coordination for you if you are on Medicaid. So really all it is making sure that you have that insurance card if you're on Medicaid, that you have someone to call if you have a question or have trouble getting into a doctor or getting your pharmacy or pharmaceuticals, your medications. So that's all that managed care is really just a resource for you as a member so you have help navigating the healthcare system. So we did that back in 2013 to strengthen the program so that you weren't stuck calling, the state offices and not having somebody to help you figure out healthcare and Medicaid because it's pretty darn complex.
And one last question is for Medicaid, is there HMO and a PPO or a PPO?
Such a good question. So Medicaid coverage with the health plans that are coordinating Medicaid, while they're licensed as an HMO, they don't really function like a traditional HMO. And what I mean by that is You don't need to have a referral for specialists. There aren't like the same type of co-pays or co-insurance that there is, in commercial insurance. So it functions in my mind a little bit more like a PPO, but it is licensed as an HMO. So it's just kind of a hybrid.
Okay. Thank you so much. You
Thank
were very
you, Louise.
informative.
I appreciate it. Patrick, you're on with Samantha.
Great. Thanks for taking my call. Great show today.
Thank you.
Just two quick questions. I may have missed the answers to these because I came in the program late, but quick question. Two questions here. If I'm hospitalized on Medicare, is there a limit to the number of days that I can be on a doctor's care?
So for Medicaid, there is no limit. It's just based off of course, medical necessity and how long you need to be hospitalized. Medicare's a little bit different in that there are some co-insurance where you as a patient will be responsible. But again, it's really just based off of how long you need to be hospitalized and what's the situation and what's your healthcare status.
Okay, thank you. Second quick question. I don't know if you talked about this, but with the new administration coming in, is there like one or two things that you are really excited for changes in Medicare that you think that everyone will be pleased with?
Oh, that's a good question.
Yes, Patrick. Oh, so good. I'm so excited about certain things. The big one is here in Illinois, we did something a few years ago where we expanded health care coverage to pregnant women to a year postpartum. And we've been trying to get federal support for that. And I think that this new administration is going to be more likely to give the state of Illinois federal support for that expansion so that we can ensure that pregnant and postpartum women get the health care coverage that they deserve, and that we strengthen our overall health care system. And that is one of the things I'm just most excited about with this new administration.
Great. Thank you. Great show again. Thank you.
Thank you, Patrick. I appreciate that. Well, Samantha, like I said, you did a yeoman's job today. Thank you so much. I hope you enjoyed the callers as much as they enjoyed you. What would you like to leave our callers with?
Perry, I just want to thank you for the time. I want to really be a resource for your listeners. And if they want to learn any more about Medicaid, they can go to our website, imhip.net, iamhp.net. They can listen to our podcast. And then I believe we're going to be, doing these throughout the month and really want to cover going forward, talk about the maternal health care coverage for Medicaid. And then, of course, COVID and COVID vaccine and what Medicaid's doing for those services.
Oh, good. I'm so glad that you'll be joining us about some more. Samantha, you are excellent, an excellent guest, and I have really enjoyed you. Thank you so much.
Thank you so much, Perry. Stay well and have a wonderful day.
You too.